Hello, everybody. It's Dr. Evan Katz here from Katz Chiropractic and Rehabilitation in Boulder, Colorado, with my wife, Dr. Shauna, and with Professionally Integrated. So, I want to go over stroke and chiropractic. We hear a lot careful, chiropractors, they can stroke you out, and chiropractors can stroke out necks. Well, I've had a theory here, and I've actually been involved in a couple of cases as an expert where I honestly feel that a lot of the patients that go into the chiropractor maybe having a vascular issue. And we're going to discuss a paper that was just published in World Neurosurgery, where they looked at some really fascinating windows, I'd say, into stroke. And I actually look at this a little bit into maybe true structural chiropractic care like CBP can actually reduce stroke. So let's come take this journey with me. So my wife and I and other authors in 2019 published a paper that showed abnormal cervical curves lead to poor blood flow in the brain. We published that in Journal of Brain Circulation. We also showed that, at least according to Google here, that why do most people go to a chiropractor? Well, they go because they have neck pain, unilateral neck pain and headaches, right? So they're coming into the office with neck pain and headaches. What are some of the common signs of a stroke? Well, again, just quick Google search, not the most scientific, but look, most people go for neck pain. So is it possible that these patients were already having stroke-like symptoms before the adjustment? And then when it didn't get better, we're like, hey, let's go get checked. And then like it's a vascular event. Oh, you saw a chiropractor. They must have been the one, as opposed to what is the likelihood that these patients are having a stroke-like event? And should every chiropractor, PT, medical doctor, surgeon, PNMR doc, that if you have headache and neck pain, should the first thing we do is a vascular study? So let's take a look at what we have here. Well, according to World Neurosurgery, published recently, the title of this paper is Posterior Circulation Ischemic Stroke is associated with more severe forward head posture in patients with cervicalgia. So let's take a look at what they found. Well, approximately 20% of all ischemic strokes involve the posterior circulation of the brain. I put this little picture down here. And the posterior circulation of the brain is mainly supplied by the vertebrobasilar system, which arises from the left and the right subclavian arteries and course through the transverse foramina of the cervical vertebra, leading to the vertebral artery. So let's take a look further at what they show here. So we know, at least according to this study and others, including the one that I published, that forward head posture, or FHP, as well as a loss of the curve, can cause vascular strain. So how many of these patients going into the chiropractor office have abnormal spinal alignment that already are having vascular strain, and maybe they're having a vascular incidence? Well, let's take a look at what the World Neurosurgical reported. What they show is that, however, the effects of more common chronic anatomical changes of the cervical spine, such as forward head posture, which is a common finding in neck pain, on the development of posterior circulation ischemic strokes have not yet been studied. But in patients with cervicalgia, neck pain, forward head posture is the most common chronic cervical postural deviation, occurring along the sagittal plane, meaning from the side of the neck. It is generally manifested by an excessive anterior head position relative to the shoulder. They also show that this abnormal spinal curve can affect the vertebral artery territory that traverses past the cervical spine. So this is an x-ray I took from my patient. On the left there, that is a normal neck. On the right is my patient. Mid-cervical kyphosis with massive anterior head translation or forward head posture. According to World Neurosurgery, and we're going to get into this could be a significant finding leading to a stroke for vascular. And we've said this as chiropractors forever. It's affecting the neurovascular system. So is stroke associated with abnormal neck curve? Well, in this paper, in the context of this case-controlled study, they hypothesized that posterior circulation strokes can be associated with chronic anatomical changes of the proximal vertebrovascular artery territories, as seen in patients with cervicalgia who exhibit more severe forward head posture. We suspect that this anatomical change may cause an alteration in blood flow dynamics, potentially affecting the more distal vertebrobasilar territories. So, what they are saying is what chiropractors have always said: an abnormal shape of the neck or a true subluxated neck is increasing the likelihood of a vascular event. They show here that this study specifically used three of the well-known criteria of forward head posture. They looked at the C0 to C2 angle, C2 to C7 angle, and the sagittal vertebral axis, or SVA. What CSVA just means cervical sagittal vertebral axis, as objective metrics. That's why, in my opinion, really good chiropractors measure and annualize objectively. We hear a lot, insurance companies and docs like, oh, the shape of your neck is no big deal. We know that's not true as chiropractors. Now, world neurosurgery is starting to link this, saying, hey, there's something here that these patients may be having strokes due to the shape of their neck, which is what chiropractors are actually trying to fix. Good chiropractors, CBP docs that are shown to actually be able to change the shape of the neck. Here's the pictures they put in their paper. As you can see, they look at what normal is. I don't care what insurance companies or IMEs say that there's no established normal. We know that there's an established normal. And so does this paper as well. So how did they do this paper? Well, here's the materials and methods. They started in 2007 and they followed patients for 2023. And then they matched their age, sex, ethnicity, as well as their x-ray shape to determine what patients had strokes and what didn't. And again, they looked at the shape of their neck as it relates to posterior vascular circulation. All of these patients, all included patients with stroke and neck pain, were paired with patients without posterior circulation stroke and with a diagnosis of neck pain who possessed a lateral cervical x-ray. They were the controls and they were matched for sex, ethnicity, so on and so forth. So what is normal, right? Sorry to insurance and all the haters out there like, oh, loss of curve doesn't mean anything. It might be normal for you. We know that's not true. So again, here's normal. This is what normal neck should look like. I showed it in my x-ray where I had my patient's neck next to a normal. That is what normal is supposed to be. Here's some line drawings. So what are the results from the World Neurosurgical? Well, let's take a look. They looked at 206 patients. 103 had posterior strokes. 103 did not. They found that in the stroke cohort, 62 patients had posterior stroke CTA imaging available. The CTA findings in stroke cases revealed an average vertebral artery vessel diameter of 3.8 millimeters on the right and 3.7 on the left. Based on the available post-stroke event, the findings that 42% of patients had evidence of acute vertebrobasilar occlusion. 47% of the patients had evidence of chronic vertebral calcification. 10% had chronic basilar calcification. 8% had evidence of vertebral artery. But the end here, 4.8% of the patients experienced a vertebral artery dissection. None of them had chiropractic. So they had unilateral neck pain, and 4.8% of them had already had a vertebral artery dissection. Now, if this person went to the chiropractor and the chiropractor just touched them once and then they did the exam, what would they say? This person, the chiropractor stroked them. Well, 4.8% of the patients studied already had a vertebral artery dissection. Now, let's take a look at this. What are the stroke rates in chiropractic? Well, I did a quick Google search. The risk of stroke following chiropractic neck manipulation is very low. It's not zero, obviously nothing's zero, but one estimates, and again, this is malpractice rates and so on, 1 in 5.8 million to 1 in 400,000. So remember, 4.8% of that population in World Neurosurgical had a stroke. Look at I did 1 in 5.8 million is 0.0001724%, and the lowest with 1 in 400,000 is 0.00025%. In that study, 4.8%. We're talking chiropractic cases as 0.00001. Now, what if of that 0.00001, we analyzed the unilateral neck pain and did angiograms? Would 4.8% of that have a stroke before we touched them? And then what would the risk of stroke be for chiropractic? Crazy low. So let's take a look even further here. Here are some tables from the study. As you can see, they looked at posterior strokes, but they looked at the control and the cases, and they looked at x-ray measurements, something that I do in my office and other structural chiropractors do, where we're not just looking at C1 or C0, we're looking at every angle of every cervical vertebra and the shift. And look at the difference. There's a significant difference between abnormal cervical curve, between the control and the cases. And look, abnormal curves. They have a buckling in their low neck and they have significant anterior head translation, which is irritating the vascular system, something that our paper discussed again in Journal of Brain Circulation. So what do they find after 16 years of studying this? Well, in this 16-year retrospective matched pair case control study, 103 patients with a diagnosis of cervicalgia, neck pain, and posterior circulation ischemic strokes were compared with 103 control patients with just neck pain. And what they find? Well, despite controlling for known risk factors of stroke and cervicalgia, certain identifiers of forward head posture severity, such as a C0 to C2 angle and SVA, were significantly different between cases and controls. They found that an abnormal neck shape, what chiropractors say, a subluxated neck, these patients' necks are subluxated before they get to an office, or in this, these patients didn't come to a chiropractic office. So I look at this as an abnormal neck shape, something that true structural CBP docs work on and improve. An abnormal neck curve dramatically increases risk of stroke. I don't think it's chiropractic increases the risk of stroke. In fact, I think not getting true chiropractic corrective care increases the risk of stroke. So let's take a look. They found a significant standardized difference of 7.1 in the C0 to C2 angle between cases and controls as a clinically relevant finding because it anatomically involves the proximal territory of the vertebral basilar system, which is the most tortuous and least protected and therefore potentially vulnerable to anatomical change. Additionally, the significant standardized difference of 10 millimeters shift, just 10 millimeters, may explain the anatomical stretching of the vertebral artery with an increase in the severity of forward head posture. A 7.1 difference in C0 to C2. We see way more than this in our office that we try to fix. And then look at the change of their neck. Now, down at the bottom here in red, what did they find? The significant difference in the severity of forward head posture and an abnormal cervical curve between cases and controls supports the study's hypothesis that posterior circulation ischemic stroke is associated with severity of forward head posture in patients with cervicalgia. These patients have abnormal neck curves and neck pain, and the abnormal neck curve is putting stress on the vascular system. In our office, when we do true corrective work like CBP care, doing that and restoring the curve, at least according to this paper, minimizes the risk of stroke. Not seeing a corrective chiropractic care, from what I'm reading in this, appears to increase the risk of stroke, not the other way around. To further establish our assumption about the changes in posterior circulation flow regarding cardioembolic and arterial to artery embolic strokes, we did a separate analysis on only presumed embolic cases, so 56 cases, 56 controls. The similar statistical significant findings, the difference in C0 to C2 angle and the abnormal curve, and their head being forward, not only proved the consistency of our findings in this subgroup, but also showed even more significant results. 9.29 greater C0 to C2 angle in embolic cases compared to 7.1 in all cases combined, and a 14.6 millimeter higher SVA shift in embolic cases compared with 10 millimeters. So only a 14 millimeter, the more significant difference from C0 to C2 angle and SVA shift, and therefore more severe forward head posture, that abnormal curve observed in embolic cases compared with thrombotic cases, suggests further dynamic blood flow changes. What is their conclusion? This study demonstrates that chronic anatomical change of the cervical spine may be a risk factor for posterior circulation ischemic stroke. In this retrospective case control matched pair study of 206 patients with a diagnosis of cervicalgia, a statistically significant higher rate of posterior circulation stroke was found in patients with severe forward head posture based on C0 to C2 angle and SVA shift measurements. Additional larger studies in vertebrovascular. So what's my conclusion? Many patients report to chiropractors with neck pain and headaches before they ever get adjusted. Many have abnormal neck curves before the first adjustment. Is it possible that that abnormal neck curve is increasing the vascular system, leading to vascular issues? And then if they don't resolve and then they get an image and they have a stroke, they're saying it's the chiropractic. According to this paper, as I mentioned earlier, at 4.8% head strokes and 0.00001 of chiropractic adjustments, it appears that not having a good neck curve is what's causing the strokes. These patients' vascularity system is already being stressed. So in my opinion, maybe true structural care like CBP actually prevents strokes. Maybe our care is what it can minimize strokes. They compared stroke patients and non-stroke patients, neck patients, no neck patient. What was the difference? The shape of their neck. What can fix the shape of the neck outside of them fusing it into a normal curve? The only thing that's been studied and published with consistency is structural CBP chiropractic care that's been published in multiple randomized control trials. Now, do I see some chiropractors flexing people's necks and rotating, yanking on their skulls? And could that lead to vascular issues? Absolutely. But that's not something we do in our office. And as you can see here, to me, you want to keep a risk of stroke. Get your neck checked before it starts to hurt. You might have abnormal sagittal alignment leading to, we know that in studies it pulls on the spinal cord. Our paper showed in the Journal of Brain Circulation, and now World Neurosurgery did a 7-year, however many year study this was, showing the increased likelihood of posterior ischemic strokes is due to a truly subluxated neck. Get to a good structural chiropractor and reduce the risk of stroke. Thanks so much.